Hello, everyone. My name is Tatum Littlejohn, and for show off 5, the topic I had was the glossopharyngeal nerve, which is also cranial nerve, 9 of the 12 pairs. So, the glossopharyngeal nerve is a mixed nerve, and mixed nerves are when they contain both of the fibers, so they are both motor and sensory. So this nerve originates from the brainstem and then it leaves the skull through the jugular foramen. So if you look at this picture right here, you can see the nerve is right here. So it's kind of in the back of the throat. So the glossopharyngeal nerve has 4 different nuclei, which are the nucleus ambiguus, the inferior salivatory nucleus, the nucleus solitaris, and the spinal nucleus of the trigeminal nerve. So for the nucleus ambiguus, that's when the motor fibers originate in the upper part of the nucleus ambiguus in the rostral pons, which receives bilateral supranuclear innervation from the corticobulbar fibers. And then for the inferior, the automatic parasympathetic fibers arise in the inferior salivary nucleus located in the dorsal pons. Then for the third, located in the dorsolateral medulla oblongata and the lower pons, which conveys taste sensation from the posterior third of the tongue. And then for the last one, it's located in the caudal aspect of the pons, which conveys somatic sensation. So if you look right over here, it shows all 4, which lead to just a little bit more information about each one of them. So for nerve innervation, I thought that this was a good graphic that I found because it shows the component, it shows the associated nucleus, along with what is being innervated. So for the functions, the glossopharyngeal nerve is involved in taste, salivation, swallowing, speech, the tonsils, blood flow to the brain, and the middle ear. There are many glossopharyngeal nerve functions. They affect the muscles, organs, and body processes near your throat, such as the carotid sinus. So this is a hollow area that helps blood drain from your brain into the carotid artery in your neck. It has a role of regulating blood pressure. Then the middle ear, sensory nerve fibers enable you to detect fullness from fluid buildup. You can also feel pain from an ear infection. The parotid, which is the saliva gland, it decreases saliva production when you finish eating. Part of your tongue, so this nerve helps you taste food in the back third of your tongue. The stylopharyngeus muscle, it's a lung muscle that runs down the back of your throat, and this nerve connects to the muscle, which lifts the voice box, which is your larynx, and nearby the throat, which is your pharynx. This makes it possible for you to be able to swallow. And then lastly, for tonsils, sensory nerve fibers help you sense pain from a sore throat or swelling due to an infection. So if there is damage to this nerve, then that would, like an example of this would be glossopharyngeal nerve palsy, which is paralysis of the glossopharyngeal nerve. This can cause loss of sensation, and you can test this by doing the gag reflex. Loss of sensation on the posterior third of the tongue. And then if you have glossopharyngeal nerve lesions, it can produce difficulty swallowing, impairment of taste over the posterior third of the tongue and palate, impaired sensation over the posterior 1/3 of the tongue, palate, and pharynx, and an absent gag reflex and dysfunction of the parotid gland. And again, this is just another picture showing where it's at. Lastly, testing the nerve. You will have the patient open their mouth and inspect the palatal arch on each side for asymmetry. You'll use a tongue blade or a tongue depressor on the base of the tongue, gently if necessary. You'll ask the patient to say ah as long as possible. Observe the palatal arches as they contract and the soft palate as it swings up and back in order to close off the nasopharynx from the oropharynx. If it is a normal palatal arch, it will constrict and elevate, and the uvula will remain in the midline as it's elevated. But if there is paralysis, then there is no elevation or constriction of the affected side. You'll next warn the patient that you're about to text their gag reflex, so you'll gently touch the first one, and then you will touch the palatal arch with the tongue blade, and you wait for them to gag. And that is all. I hope you all have a good weekend.